Research shows this as well. 60 to 80% of chronic disease is either caused by or related to something going on in your mouth. And I had never realized that before. I never recognized because that's exactly how dentistry is often portrayed is it's construction, it's mechanic work, it's just fill, you make a hole and then you fill it up. But the things that we're doing in that construction and mechanic work affect every other cell in the body.
Are you curious about discovering ways of making your life better? Then welcome to my podcast. I'm Bob Nickman, and this is The Exploding Human. Listen in while I talk with all kinds of people in the fields of personal growth, health and healing, alternative therapies, psychology, spirituality, environment, and the future. I'm looking for those answers that make life better for everyone. You'll meet cutting-edge practitioners, doctors, artists, filmmakers, business people, and those who have overcome challenges. The brave, the curious, anyone who's out there helping us humans to explore, expand, and explode. Hey, welcome to The Exploding Human. My name is Bob Nickman. My guest today is Dr. Michelle Jorgensen. She is a dentist who, after more than 10 years in practice, began to experience symptoms which escalated until she finally discovered she had mercury poisoning from taking out other people's fillings. This led her to research and discover other things which she had not learned about the mouth and the teeth and dental practices. A great deal of what she has learned is not taught in dental schools. It still isn't. We're going to be talking about cavities, tooth enamel, fluoride treatment, root canal, sleep and breathing issues, all tied to the mouth. And we're also going to be getting into some of the innovative solutions and practical things anyone can do to improve their health. This is Dr. Michelle Jorgensen. Great to see you, Michelle. Thanks for being on the show. What an interesting story you have. Why don't we start with that? I mean, you're a dentist. All of a sudden, you're not feeling well. You can't figure it out. What happened? How did this happen?
Yeah, it's definitely been an interesting journey for sure. I'm a general dentist, was practicing for about 10 years or so. And at the time I was practicing with my father, and he is still practicing in his mid 70s, hasn't had a sick day in his life. And I just thought that that's how it went. You just kept doing this forever. And about, like I said, 10 years in, I started having symptoms of things that at first I just wrote off as normal. I started having gut issues, and everybody does, right? Yeah, that's what you tell yourself. And so we started changing our diet, and some things started improving, but not completely. And then I started having memory problems, just short-term memory issues and things I couldn't recall. I had just learned, had learned a patient's name and I couldn't remember it by the time I went to the next room over. And I've always had a really good memory, so this was definitely different. But the big one was numbness. I had just really painfully numb hands, and I couldn't do things like blow dry my hair or chop onions, and I couldn't hold my instruments anymore. And so I went to doctor after doctor after doctor, and nobody had any answers. They would, just say, oh, this is acid reflux, or, you must have a nerve pinched. And so I was, seeing the chiropractor twice a week and massage twice a week, and it just wasn't going away. So finally, I had to put the practice for sale because I couldn't do my job. I literally couldn't do the job. And I didn't know what I was going to do. I was in my mid 30s, 4 young kids, and, debt still on this practice. And it was our entire livelihood. And it was really desperate, dire times. So I was reaching out to anybody and everybody I could. What can I do instead? And finally, another dentist said, you sound a lot like me. Have you ever looked into mercury poisoning as the possibility? And that was the first time anyone had ever said that to me, inside of dentistry or out. And I said, well, no, I mean, I know silver fillings have mercury in them. We're taught that in dental school. But I said, but I don't have any fillings. And he said, it's not the fillings you have. It's the fillings you've been drilling out for the last 10 years without any protection. And again, that's the first time I'd heard anything like that. So he said, what do you have to lose here? Let's, might as well just get tested. So I got tested, and that's what it was. Mercury levels off the charts. So all of a sudden, all my symptoms made sense because mercury is a neurotoxin. So it's going to affect your brain and your nerves and your hands and your function and even your gut. And so I was an absolute mess. And I was, really relieved to find an answer, but a little furious that this could happen to me as a practitioner, and nobody had ever said that this was a problem. Nobody had ever mentioned this ever in the entire, my entire education or profession. So it was an interesting thing and an interesting place to get to of like, wow, okay, what else do I not know about dentistry and about the profession that I'm literally practicing inside of? And how could this affect me, my patients, everyone else? So it's really taken me on a new journey I did not anticipate.
Like, why wasn't your dad affected by it? Let's say he did the same things you did. He was taught the same way. He'd been doing it even longer.
Even longer, and he actually had more exposure because even before I was doing, placing mercury fillings, and I had stopped placing mercury fillings. I wasn't placing them at all anymore, but I was drilling out a lot because I was a cosmetic dentist. So, he had even more exposure. They used to use these mercury squeeze cloths where you'd put the liquid elemental mercury with these silver shavings and rub them together in this cloth. I mean, he'd even done all of that, years ago. And what I found is there's actually a genetic variation called MTHFR. You've probably heard of it. A lot of people have nowadays. People are finding it's about 30% of the population, and you can't process toxins very well. And I have this. I have one from my dad, one from my mom. So my dad didn't have the same genetic variant. I do because I got one from both. So
Yeah.
basically, my body looks at mercury and it doesn't know what to do with it. It doesn't know how to get rid of it.
So you're
And
genetically predisposed, obviously.
genetically predisposed. And also, research shows that the mom's body detoxes into the first baby that they have. My mom's mouth was full of mercury fillings, and I'm her first child. So I think I probably had a mercury load from birth and then entered the exact wrong profession, if that's the situation, and just continued to get it. And my body simply could not dump it.
See, that's one of those things you wouldn't know it because obviously they're not teaching that in dental school. I guess they don't do mercury fillings anymore because
Yes, they do.
Oh, they do?
Yes,
I
they
didn't.
do. They are still allowed. This every single time on a podcast, everybody says, "Oh, they don't do them." And I'm like, "Yes, they do."
Well, my dentist doesn't do them.
No, but there's still dentists, and it's still allowed in the United States. All they say is that they don't recommend them in children under the age of 6 and pregnant women. But then I always say, but why else? Why everybody else? If it's a concern for those.
Yeah.
And there's interesting things. I try to get this information into the dental profession. They all say it's just fine. There's no issues here. But if you look at statistics, this has always been a statistic that's bothered me greatly. Dentists have a high rate of suicide. And I've questioned that in the past, and I've said, why? Like, this is so weird. Why would we have a high rate of suicide? Oh, because it's just so stressful. I'm sorry. I can think of some careers that are way more stressful than being a dentist. So no, it's not that. It's that mercury is literally poisoning our brains and not allowing us to think correctly and feel correctly anymore. And anyway, it's just a little crazy that it's still allowed and that we still are doing it and still dentists are still placing it. Dentists are removing it every single day unsafely. Because I learned there are entire different protocols for how to remove this. The doctor told me, okay, if you're going to get it out, you can't keep putting it in. So I had to go find where there are ways to remove fillings so I could keep doing my job. And I found that there were. And these things are just not talked about. And really, I have a personal belief about this. The world that we live in, particularly the United States, is very litigious, very, they're going to sue about everything. And if the American Dental Association, the FDA were to come and say, these silver fillings, they're 50% mercury, this is really dangerous to your health, every dentist that has placed or removed a filling would be under a class action lawsuit. So it can't happen. So this is why I share for both, profession and patients alike, because the regulatory agency simply can't say it.
Isn't that sad? I had a guy on here who he was a spine surgeon, and he was talking about, and he'd written a book about pedicle screws, which are the screws they put in people's backs for when they have issues. And he's basically, saying they don't work. And it's heresy in that world. He goes, I still have to do it because it's the only legitimate procedure. He goes, but I don't recommend it, obviously. He goes, but there's doctors that they basically paid off and co-opted to sign off on this stuff. So there is things in the medical profession that are just not, on the up and up. And it is about money. Of course it's about money. So, the fact that you're doing this is important. It's brave, and I'm sure you know. Have you taken any hits from the ADA? Is that what they call it?
Yeah, thankfully, no, because I'm very careful and just honest to say, the profession in general just doesn't know. We don't know. There's
Yeah.
research shows that everything I say is true, but we just don't know. And so it's not that dentists or dentistry is trying to hide this and put the world, pull over the, the world, wool over people's eyes. We as dentists really don't know. And like you said, you thought that fillings were had no longer, being placed.
Yeah, I
And
did think that.
and
Yeah.
everybody says, well, they're just silver fillings. Well, they're silver plus copper plus tin plus nickel plus mercury and
Those are all
50% mercury.
toxins. Those
Yeah,
are all toxins.
they're
Yeah.
all problematic. So we don't want any of those things in our body. You just don't, you say silver, all they're silver fillings. Yeah, but 50% mercury.
Oh,
So
what wow! It's and the suicide thing is incredible because I remember hearing that statistic that
yeah,
dentists were very high in suicide. I'm like, why? I had
exactly.
the same thing. It's like how hard is it? How
How
it's not
stressful.
depressing. People aren't dying and
No,
getting their teeth cleaned or getting a cavity filled.
no.
It's not depressing. It's just a big money maker. It's like, it's like mini construction work is how I always saw dentistry. You're hammering and
It is
drilling and pulling and digging holes and sewing things up and
exactly right. Yep.
putting in
Yep.
cement.
Yep.
It's
We're
really
mechanics
it's
of the mouth.
construction work.
Uh-huh. Yep, we're mechanics. Yeah, mechanics of the mouth, basically. Yep, exactly.
Yeah.
So that was just the first thing. So as I
Yeah.
started learning about all of that, I thought, okay, what else do I not understand about how dentistry can affect the rest of us? What else is going on in all of this? And it was interesting because as patients started showing up and I had all of these new things I was doing, we had special mercury filtration masks and a big vacuum that sits at the base of their chin and we cover up their body and all these things people started saying what are you doing? This is a little wacko.
Hmm.
What's going on here? So I'd explain the story and my situation and I was doing it for my own purposes, my own health, but they would
Hmm.
all say, well, this is good for me too, right? Yeah, this is good for you too. This is the way you should have them removed as well. So then they would start telling other people about it. Oh, I think that, my neighbor is interested in something like that. And how about my doctor? And so doctors started actually coming and saying, well, have you heard the problems or the risks with root canals? And what are your thoughts about fluoride? I've heard maybe there's some iffy things there. Or,
Yeah.
they started asking me these questions. Have you ever heard about ozone? And I didn't know anything about any of these things. None of them. So I've had to go and research and study and learn myself and have learned that, and research shows this as well, 60 to 80% of chronic disease is either caused by or related to something going on in your mouth. And I had
Wow.
never realized that before. I never recognized because that's exactly how dentistry is often portrayed is it's construction, it's mechanic work, it's just fill, you make a hole and then you fill it up. But the things that we're doing in that construction and mechanic work affect every other cell in the body. And that's the piece that often isn't discussed or understood is how does everything that we do to the body in one place affect it elsewhere?
Yeah.
And how much can this dentistry, root canals and fluoride and mercury, how much can it affect everything else? And it's enormous.
I've heard a little bit about this, not as much as you have. Obviously, I haven't studied it, but the idea. Well, first of all, the first way you relate to the world when you're a baby is your mouth. That's really the first thing. You're eating, you're crying, you're making noises, you're breastfeeding, whatever is going on. That's the first way, and it's really close to the brain, and it's a direct tunnel. I'll just call it a tunnel to the stomach. So it goes both ways, very intensely. So when you think about it, it makes a lot of sense, and it's an easy place to get infections or bacteria. Let's just put it that way. It's a place where you're going to get a lot of bacteria for whatever reason, and then you put chemicals in there. It's a real, I don't do well with fluoride. My body reacts to it in a way that makes me feel sick, and so I told the dentist I don't really want to do it. I looked it up a little bit, and I know there's some naturally occurring fluoride in certain parts of the certain water in certain parts of the country, and this is the story. They noticed that people got less cavities in these areas that had the higher fluoride,
Exactly.
and so but then it's also, from what I understand, a byproduct of the aluminum industry. If that is accurate or not, I don't know. But I was reading about that, and I thought, well, you know, fluoride is in those vats when it's bought commercially, I think, with the skull and crossbones on it, whatever that is. So what is this stuff exactly? There's naturally occurring fluoride. There's the stuff that's manufactured for the dental profession. Even though it's masked with flavors, it kind of makes you queasy when you do it. Does it really work? I don't know.
These are all good questions. And this is
So
something that's
talk
really,
to me about fluoride, because everyone gets the fluoride treatments now. It's
yep.
just, and it's in the drinking water too. That's just a whole other thing.
Yep, it's a real hot topic right now, and it's becoming politicized, which, for good or for bad, it's bringing a lot of attention to it. So that's great, in my opinion.
Mm-hmm.
So you're exactly right. The origins of it are dentists were attempting to eradicate tooth decay. They want cavities to stop. And they learned or figured out that people who had more naturally occurring fluoride in their water had more cavity resistant teeth. So they thought, this is fabulous. Let's put fluoride everywhere. Let's put it in toothpaste. Let's put it in mouthwash. Let's put it in the water. Let's put it everywhere. And it's going to just do away with tooth decay. So then my next question is, has it worked? Has anyone gotten a cavity since 1940?
I got a lot of them.
Exactly right. Yeah. Exactly right. There have been cavities since 1940. So
lots for me.
Obviously, this has not eradicated tooth decay. It hasn't taken care of all of that. But what is it really? And do we need it? Like, do our teeth require it? So let's dig into that a little bit. The enamel part of the tooth is minerals on the outside. So the part you see, and you were just saying, you're whitening it and it's getting nice and bright. What is that? That is minerals. That's the mineral layer of the tooth, the enamel on the outside. When you eat sugar, the sugar create acid, which will dissolve the minerals in your tooth. It's just like if you pour the Coke on the battery terminal, it's like, it puts away all that corrosion stuff. Same thing happens in your mouth. So acid in your diet, acid from bacteria. This is why your mom told you to brush your teeth, so that the bacterial acid doesn't sit on the teeth. If it does, then minerals get pulled out of that enamel and it leaves a little tiny hole. Bacteria crawl in. They eat more sugar, they leave more acid, eats away more minerals, hole gets deeper. So this is what happens. So a cavity is not a deficiency of fluoride. A cavity is a deficiency of minerals. When the minerals are lost, that's when the cavity develops. So what's been happening is the fluoride has been used to strengthen that enamel matrix, that crystal, and it does strengthen it, like no question, it absolutely does. But there's more to it than just that, because there's other reasons we lose minerals. You might not be eating enough minerals. You might be a 17-year-old boy and your bones just grew literally 4 inches this year, and your body needed so many minerals it couldn't keep up with your teeth and your bones at the same time. There's so many other reasons. That's one issue. The other problem is fluoride doesn't just stay in your mouth. It goes everywhere. And so, interestingly enough, in the 1960s, they used to use fluoride as a treatment for people who had overactive thyroid function because they knew it decreased thyroid function. And this is, in fact, true. So thyroid interferes with the way that your fluoride interferes with the way thyroid hormone is activated, because it's activated with iodine. Fluoride and iodine are very similar. They're cousins. So fluoride is a big bully cousin, and it pushes iodine out, and now your thyroid hormone isn't usable. So you're tired. You can't figure out why. You go and get medication for thyroid issues. Fluoride also changes the structure of your bones. So now they become a little more brittle. And just literally in January, there was new research showing fluoride decreases IQ levels in developing children, particularly boys. So you get all these things added up together. Fluoride weakens your bones. Fluoride slows down your thyroid. Fluoride affects IQ levels. And it didn't do the thing we'd hoped it did. It didn't stop cavities. So are we willing to take these side effects for something that didn't work in the first place and for something that really isn't the cause of cavities? It's all about minerals. So for me, there is zero reason to ever use fluoride. Zero. We have zero in our practice. We have a very large practice. We don't use fluoride in any shape or form. And I have a whole line of tooth care products that have what's called hydroxyapatite in them. Hydroxyapatite is the minerals your teeth are made of. That's what a cavity is. A deficiency of minerals. A deficiency of hydroxyapatite. Let's just put back what was lost. You don't need fluoride.
does the amount of fluoride being used, and let's say you get your teeth clean and they give you a little cup to swish around in your mouth for whatever, a minute. They time you, and you're by the end of it you're like gonna throw up. But that's what got me to stop doing it. It's like, if my body's reacting to this and I'm not even swallowing it,
Mhm.
how good is this for me? It can't be good for me. My body's
Not good for you.
telling me, get rid of this.
Yep, yep. And that's a high concentrated amount in that little cup. That's a lot because it's a professional strength there.
And so that amount could do have those effects on people, even if they did it 2 or 3 times a year. It could affect their body, if they, particularly if they
Yes.
swallowed it, obviously.
For
But
sure if they swallow, but the even bigger one is when they add it to water, because that's every single thing that has water in it. So it's not only the water you're drinking, but it's also the water that they're using for processed foods, for beverages. So like if your
yeah,
favorite drink, whatever it is made with water that has fluoride in it, then that's now dosing you more fluoride. So it's not just that. It's also the toothpaste and the mouthwash, and it's the cumulative dose.
yeah. Well, just
It's
taking a shower, it's going in through your skin.
all of the above. And
Mhm.
again, like we said, it doesn't do what we hoped it did. So I'm so excited. I live in Utah, and Utah is the first state in the United States that has actually banned water fluoridation literally just today. This just came out, just was
Today.
signed by the governor. Yep. So it's the first state to ban water fluoridation. I'm just so proud of them for actually looking at the science. But the interesting thing is the American Dental Association was not happy. They had representatives here. They were writing letters. They were talking to all the dentists in the state to get them to petition against this. And I said, excuse me, I actually agree with this. This is one that I'm really for. I'm not going to petition against this
Mhm.
one. So they were trying to get all the dentists to say this is a bad idea because, again, the message and the standard of care is fluoride strengthens teeth. And it's true, but there's so much more to the message. Fluoride also causes all these other health problems. And there's something else that works.
There's be more money to be made using it than not using it.
Well, they can make money using hydroxyapatite. That's just fine with me. That's what
Yeah,
teeth are made of.
sure.
Let's
Okay.
use that. But yeah, you can probably usually always trace it back to something there.
And what is that hydroxyapatite? What is that
It's just
exactly?
minerals. So it's literally the mineral your teeth are made of. So it's just a
But it
combination of calcium and phosphorus and hydrogen, and they're all just hooked together, and that's what you see when
okay.
you smile.
So are there commercial toothpastes with this, or do you have to get it in another way?
There's starting to be more and more. I couldn't find one that I loved, so I started my own line of hydroxyapatite products because I talk about this all the time. I want people to have some place and something to use, but you're going to hear it more and more. It's starting to become more and more
Okay.
common.
Well, I'm into this now. I'm really, well, I was in the beginning, but
You
now I'm
didn't
more
like
into it.
fluoride to begin with. Yeah.
No, my body reacted to it. Okay, now let's talk about two other things: root canal, because you mentioned that,
Yep.
and gum recession. I want to talk about those two things. Now, these are things everyone deals with.
Yep.
Everybody.
Yep.
This is not rare, strange medical things.
Nope.
This is 3, 4 times a year. You're going in, and you're being told, "Oh, you got some gum recession," and I have this. I have it.
Mm-hmm.
I have gum line fillings. I have all that stuff,
Mm-hmm.
but they're not mercury.
That's
Um,
very good.
let's talk about. Let's do root canal first, and then gum recession. I want to talk about those.
Okay. All right. Root canals are an interesting thing. The concept of them is so good. If you have a deep cavity or you have a cracked tooth or something like that, and it either affects the nerve or it kills the nerve. So the nerve actually dies. The nerve is in the inside of the tooth. There's nerves and blood vessels that live on the inside of every
Yeah.
tooth. So if the cavity gets to that point and the tooth dies or it's really hypersensitive, then
Yeah.
you've been told you need a root canal. I put it in quotation marks because I don't believe anybody needs a root canal, but you've been told you need a root canal. So
I'm on the cusp of one, so
here we go. All right.
okay, okay.
So let's talk about what a root canal even is. What they do is they open up into that nerve chamber where the nerve and blood vessels live, use some really tiny instruments to pull out that nerve, clean it all out, disinfect it, and then fill it up with a plastic-like material. It's called gutta percha. It's like the sap of a tree in Malaysia. So it's this rubbery stuff they fill it up with. The concept is awesome, right? You get to keep chewing on the tooth, you get to keep smiling with the tooth, you cover it over, and you just go on your merry way. The trouble is, there is not just that main canal that's cleaned and filled inside of the tooth. Every single tooth has little tiny side channels, little feeder channels that go off of the main canal. That's how you get nutrients from your body. all the way out to the part you can see. And that's why you can tap it here and feel it, because there's
Mhm.
little nerve extensions that go all the way into these little tubes. Every dentist knows this. So the problem is those little tubes are too small to clean and too small to fill. So you cut off the nerve supply, cut off the blood supply to the tooth, fill it up with plastic stuff, and leave dead stuff in those little tubes because you can't fill it, can't clean it all out. Well, dead stuff in the body always attracts bacteria, no matter what. I always joke and say, if you had a gallbladder attack and they said, oh, I can take care of this. We're going to go in, we're going to take the gallbladder out, take it out completely, clean it out, fill it up with some rubber stuff, and put it back in. Why don't they do that? Because bacteria always find dead stuff, no matter what. So bacteria find the dead stuff in this tooth. Eventually, it starts to eat away the bone surrounding the area. Now, every time you chew on that tooth, it's like a piston pushing that bacteria throughout your entire bloodstream. This is why so many people who have chronic low-grade disease but can't figure out why they can't get better, like they're 80% better, but they just can't quite get all the way better. We do what's called a cone beam CT scan, which is a specialized dental CT scan, and I find massive infections in the jawbone. You can't feel it, nerve's gone, don't even know it's there, no warning sign, but every single time you chew, you're sending that bacteria throughout your entire system. So your immune system's compromised, it's overworked, it can never get rid of this infection, but you don't even know it's there. So that's the problem with root canals. So if you're on the cusp of one, people always say, well, what do I do instead? Like, what can I do? So there's really a fork in the road. If the tooth is still alive, then we do everything in our power to save it. So we use something called ozone, which kills the deepest bacteria in the tooth. So we don't ever uncover the nerve, and we fill over top of it, cover over top of it. So if your tooth is still alive, you need to find a dentist that has some ozone and can actually kill those bacteria without killing the tooth in the process.
Mm.
That's fork number one. If the tooth is already dead, or you already have a root canal, and 45 million are done in the United States per year, so there's a lot of people who have them. If you've already had a root canal, at this point, there's no way to resurrect the tooth and bring it back to life.
Mm-hmm.
So we remove and replace it with a ceramic dental implant. I have a dental implant right here. Nobody knows it. I mean, it just looks like a tooth. It chews like a tooth, smiles like a tooth. And, people will say, why do dentists work so hard to save my tooth? Like they say, oh, you have to have a root canal. So you don't have to have a root canal. Perhaps you would want a tooth, but I can replace your tooth. But dentists, we're trained to save teeth. Like that is our number one mission. And we fail. That's how we are taught. We fail if we don't save your teeth. But I tell people, you know what? I used to save your tooth at any cost. Now I'm going to save your health at any cost, even if it means removing and replacing a tooth. Because I can replace your teeth all day long, but I can't replace your health.
I've had one root canal. I don't know how long ago, but and I was given an antibiotic, I guess for the reason that you were just talking about, which made me nauseous. And he said, "Oh, your body will be fine. Don't take it." He goes, which I thought was pretty cool. He goes, "Your body should be able to take care of this. You're pretty healthy." And that's what happened. I just quit taking it, and it was fine.
Yep. So now the question is it still fine? So that's where you need to go get that cone beam CT scan and see. Because so many times, I'll always remember the first lady that really changed my mind. She came in, she had an old root canal like you, she didn't even remember how old it was, but she said it just hadn't really felt right. Like it didn't hurt, it didn't really bother, it just didn't feel right. So I took a regular old dental x-ray, the kind that goes in your mouth, and we snapped the dental x-ray, and I said, it looks fine. Like that root canal looks just fine. And any dentist would have said the same. It looks fine. But she said, but it just, I don't know. Are you sure? And I had just got this new cone beam CT machine in my office. So I said,
say the word again, the first part of the
cone beam. I know it sounds kind of weird.
Cone beam, CONEBEAM.
AM. Yep.
Cone beam CT scan.
That's what people need to be looking for. And more dentists have them. I had just gotten my first machine. I said, let's go take a scan. I'm just super curious. Let's just see what we see. We went and took a scan, and as it pulled up on the screen, both of our jaws just dropped. There was a quarter-size hole in the jawbone that bacteria had eaten away above the top of her root canal. She had no idea, and we could not see it on the regular dental x-ray. We can't see it until we get a three-dimensional x-ray like this CT scan. So she said, oh my gosh, when can you take that tooth out? I'm like, tomorrow? How does that sound? Because when you see that, and there's such a correlation between breast cancer and root canals, between heart attacks. If you've had one root canal, your incidence for heart attack doubles. Your incidence for cancer 2.5 times. It's amazing because it just impacts your overall immune system. The root canal doesn't cause cancer, doesn't cause heart attacks. What it does is it impacts your immune system's ability to deal with other things, and it just can't do it anymore. So we
Wow, there's
dig
so
it out.
much new stuff. It's incredible.
Yep.
Wow. A CT is so what is it? Is the CT scan? Is it X-ray? What is it? What is the
Yeah.
technology?
So it's like a CAT scan, but it's much different than in a hospital. People imagine this like room size X-ray. It's not that. It's
Yeah.
it's smaller, goes around your head, and I literally have your entire skull in 3 dimensions. I can turn it up so I can look at every single bone, every single tooth, every single everything, and see exactly what's going on.
Is that like a panoramic thing or is that
It's
different?
similar. It looks like it. So it goes around
Yeah.
your head like a panoramic X-ray does, but it has expanded capabilities. Like we can see
Okay,
more.
because like now I'm going to get insurance for 1 second. So they pay for a pan X-ray like every 5 years, I think it
Yeah.
is 3 to 5. I can't remember.
Yep.
The regular X-rays you can do,
Every
whenever you
year.
want to do them, but that won't find what you just found, is what you're saying.
No, neither will the Panorex because it's 2 dimensional. So we can only
Yeah.
see
Okay.
this flat image. It's the 3 dimensional CT scan that we need to really see what's going on.
So are dentists aware of these tools other than you and
Oh,
other people
yes,
like you?
they are. They use these tools for things like placing dental implants, or usually people who do root canals, they will use these as well because they can see. Used to be we kind
Oh,
of had to guess and go, okay, I think there's 2 nerves here, 2 roots, or 3 maybe. We can see on a cone beam CT scan exactly how many nerves there are inside of a tooth. You still can't get all the little tiny ones, but so endodontists that do root canals, they have these machines. Oral surgeons all have these machines because they're looking at the jawbone to place dental implants, and more just traditional dentists or general practitioners have them as well.
does insurance cover these things, or is this is
They're
sort
starting
of
to. Yes, they're
okay?
starting to. Thank
I'm
heaven.
just wondering because God, dental insurance, which is not insurance, it's an allowance.
Exactly.
It's like 2,500 a year,
That's good
whatever.
if you get 2,500.
Yeah, whatever percentage it is.
A lot of people get about $1,000 a year, which doesn't do much of
Yeah,
anything.
what does that cover? I mean, I just did some gum line fillings, and it was my portion. I haven't paid it yet. It was $245 for I think it was 3 of them or something,
Yeah.
and it's still bothering me.
Oh,
So at the end of the procedure, the guy says, I'm still not convinced it's a gum line thing. I think it might be a root canal. This is what he says to me at the end. And I'm thinking, oh, you want to get paid twice? Is that what happened? Why didn't you check for that first?
yeah.
I didn't say that because it was done and I wanted to get out of there. But I think that's what was going on. Because the gum line fillings had not fallen out. He said, oh, you've just gotten more recession. So there's, things coming into that space, and eventually we'll have to replace the teeth. So, I'm just seeing a cash register going round and
Yep.
round in my head.
So that's where we start to use the hydroxyapatite tooth powder. So instead of a toothpaste, I actually created a tooth powder. Here's one of them, but it's a powder that you use instead of a paste on your toothbrush. But what I do for somebody just like you, for sensitivity, for root surfaces, and we actually need to get into why you have gum recession because we're going to talk about that. We're also going to talk about why do you have gum line cavities because there's 2 things happening there that we need to discuss. But in your situation, you have sensitivity along the gum line. What I recommend is you take the tooth powder after you've brushed. You actually take a little bit more of the powder, use some water and make a paste and just rub it right into those surfaces. Because remember, what is it? It's hydroxyapatite. It's the mineral your teeth are made of. So what you're doing is you're just rebuilding the teeth from the outside. You're just rebuilding those teeth with this powder. You rub it on, you go to bed. And people are reporting within about 2 weeks' time, sensitivity completely gone. Because you're rebuilding the teeth with what the teeth are made of, with
I
nothing
love that.
artificial, nothing. It's just simply putting back what they lost. So that's what you need to do. We'll get you some tooth powder sent out, and you're going to start rubbing it on the gum line
Yay.
to avoid a root canal. Because really, when they say I think it's a root canal problem, what they're meaning is I don't really know what the problem is, but if I kill your tooth, it won't hurt anymore, and you'll go away. So it's the easy out. Right? It's the easy out solution. Well, let's just kill it. Let's just do a root canal, so kill it, then it won't hurt anymore, and then the problem's gone. No, because now we've just introduced a whole bunch of new problems.
Mm,
The problem didn't
okay.
go away. The problem just now became a systemic overall health problem, not just a tooth problem. So let's dig into those gum line cavities and reasons for recession to begin with. So, two main reasons for recession. One is gum disease. So, if you actually have disease in the gums, meaning bacterial infection in the gums, tartar starts to build up on the teeth and the gums shrink down away from the tartar, away from the bacteria. So, that's one reason that people get gum recession is they have actually gum disease and the gums and bone literally try to shrink away with the thing that's causing the irritation. So that's why people get deep cleanings. That's what people call them. I had to go get a deep cleaning. That's why we're trying to get off whatever it is that your gums and bone are pulling away from. So that's one cause. And it's interesting because people think that's the only cause, but that's not the only cause. There's actually, I think, even a bigger cause on the other side. So gum disease, one. The other one is the way the teeth hit together. And this is an interesting one. It takes a little bit more explanation. Teeth really should be chewing like this on top of each other. But depending on the way the teeth are hitting, or if you're squeezing, grinding, that kind of thing, we're going to talk about why you might be doing that. It actually flexes the tooth instead of just a straight up and down force. It's a flexure force. Think about where the kind of the root line is. That's the point of flexure. So that's where the tooth flexes. So if there's a bite issue, the way the teeth are hitting together, if it's causing a tooth to flex, the gum will move down to find a more solid piece of tooth to hook onto. So this is where we'll often see recession only on a few teeth, and they're usually top and bottom. So it's like right here, these two teeth right here, recession, or these two right here, because it's the way they're hitting together. If you've got it everywhere and there's no gum disease, I then look and say, all right, do you actually have some airway issues? Are you having trouble getting enough air at night? And are you squeezing your teeth in order to open up your airway, tighten up all these muscles and get more air? That will lead to recession everywhere. So that's where I start to ask, if you were sitting in my chair, I'd say, how do you sleep? Do you snore? Do you wake up feeling great? Do you wake up multiple times a night? Like, what's your sleeping like? And then we dig into that because often that's the cause for recession is squeezing at night, trying to get more air.
Well, I definitely do that. I don't know if it's for air necessarily grinding.
Always for
Definitely.
air.
Yeah, it is. Okay.
It's always
So
for air because when you engage those clenching muscles, it tightens up the airway back here and allows more air past.
is there a relationship between that and people getting like this flap as they get older under their chin? Is that
Some
something?
that's a
Okay.
muscle laxity, muscle change issue. Yeah, that's some
Yeah.
of that's just gravity too.
So how do you correct or improve air issues? I think I've heard this that some orthodontics really create problems with that stuff. People that have braces when they're young. I know my wife had braces very young, and her posture's not great because of it.
We call it air seeking, so you end up having to put your head forward a little bit like
Yeah,
this.
her head's forward. Yes.
Yep. Forward head posture is often because she's not getting enough air at night. So it all goes back to that cone beam CT scan, the same scan. We are able to see the airway, and we're able to see, are there tongue and tissues here in the back of the throat that don't have room in the mouth. So the reason braces cause issues in some people is if they have crooked teeth and the orthodontist says, well, let's take teeth out, let's take some teeth out so that they all fit in the mouth better. Well, the problem when you take teeth out is you make the mouth smaller, right? Because now all the teeth have to come closer together and there's not enough space behind the teeth for the tongue, for all the tissue at the back of the throat, for the uvula, the soft palate, the tonsils, like all this. It can't fit inside of the mouth anymore. I like to think of it as like a big old long truck inside a tiny garage. The bed of the truck's hanging out back into the airway, into the driveway. And so now all of the tongue and everything when you lay down blocks off where your air is supposed to go. So you get the cone beam CT scan and you find out, is this the problem? Is this the reason why? If that's the case, we got to make the mouth bigger again. And how do you do this? Well, we use braces. We use clear braces like Invisalign. We literally expand the teeth out and make more space in the mouth for you to breathe. And all of this goes away. Clenching, grinding goes away. All of a sudden, people are sleeping through the night without CPAPs or any of these kinds of things needed. They're not snoring anymore. They're not waking up 10 times a night to go to the bathroom. There's no more insomnia. Everything just relaxes in the face. All the headaches and things sometimes people wake up with, they go away because they're actually able to breathe at night. And the gum recession, stops because the
Boy,
teeth
that
get
is
together.
huge. That's huge. I know so many people that have sleep issues.
You got it. This is an
So many.
absolute epidemic. In fact, I've heard it termed an epidemic greater proportion than any pandemic the world has ever seen.
Wow. Okay, let's talk about wisdom teeth because that's a big thing. Oh, your wisdom teeth are impacted and we need to take them out surgically, which I had done at like 16. I think I was 15 or 16.
Yep.
It was pretty brutal, I have to say. Took me a while to, you know, get back to something. I don't know. I had no pain. I had nothing going on that other than the dentist saw it in an X-ray and decided to do the surgery.
Yep. So let's go back even to the day you were born, from even before age 15. Um, Oftentimes, well, interestingly enough, if we look back at skulls that are, 300 years old, everybody has
Mm-hmm.
all their teeth. They have all 32 teeth. There weren't oral surgeons then taking out people's wisdom teeth. So what's happened? What's changed with people's mouths? And they weren't crooked. They didn't have crooked teeth either. Nobody had braces. So why does everybody have to get wisdom teeth out and why does everybody have to have braces? What's changed? Couple of things. First of all, our food doesn't have the nutrient levels it used to. And when food doesn't have the nutrient levels it used to, then our growth and development is affected. And here's the interesting thing. The first bone affected by malnutrition is the top jaw. When the
Mm.
top jaw forms narrow, the bottom jaw forms narrow. All of a sudden, teeth can't fit. So we get crooked teeth. And when you have crooked teeth that are in the mouth, guess what surely isn't going to fit? Your wisdom teeth. Because everything's just too small now. The mouths are just too small. And this was a Dr. Weston Price clear back in the 1930s. He's a big pioneer in the whole nutrition world. And a lot of times people don't realize he was a dentist. He went and studied all of these societies all over the world, trying to identify what did people eat and how healthy were they, to correlate. Okay, healthiest people, what do they eat? And he has a huge, 3-inch thick book all about his findings, and it's absolutely fascinating what he learned. But what he found is that the people who had better health had bigger mouths. They had more room for all their teeth to fit. And they ate 5 times more water soluble vitamins, which is vitamin C, vitamin B, 10 times more fat soluble vitamins, which is vitamin D3, vitamin K2. Those are the biggies for growing these bones right. So, most likely, birth, and on, you had things that affected the growth and development of your mouth. So, doctor looked and said, those wisdom teeth aren't going to fit in your head. So, you end up getting them out. So, people ask me now, well, do you recommend wisdom teeth come out? If they can't fit, yes, we don't have anything else to do about it because they cause infections and other issues. But if they can't fit, no, leave them be. Leave them in there by all means. But a lot of us, our mouths don't allow for it anymore. So that's why we try to jump ahead the growth and development. We look at kiddos and we say, how can we make sure that your mouths are growing big enough for all your teeth? So you can have all your teeth and your wisdom teeth and everything else. Because what you said is the next problem. You didn't heal very well after. So a lot of times these areas where we get wisdom teeth out don't heal well. Whether it's, you're 15 years old, you're not eating great, you're still growing, there's a huge demand for minerals. They don't fill in with bone and they leave dead zones in the jawbone. These dead zones contribute to inflammation in the body. So we see all sorts of inflammatory diseases related to dead zones in the jawbone. Again, we find these on these cone beam CT scans and we say, look at this, you got a dead spot in your jaw. Okay, let's go clean that baby out. And so many stories of people. I had a lady who literally she couldn't get out of bed. She was in her mid 30s, had to quit her job, living with her mom, couldn't get out of bed.
Mm.
They came and we figured out she had 4 dead zones from these wisdom teeth and an infected root canal. Took it all out, one appointment. Next morning, her mom woke up and she could hear something going on in the kitchen. Went out, she was out doing the dishes. This daughter who hadn't been able to get out of bed. She said, what in the world are you doing? She said, I feel better than I have since literally my wisdom teeth came out 15 years ago. I have no idea what happened then, but it did not heal. And it's just completely tanked her entire immune system. And we see this day in and day out, people's eczema going away completely. And I'll like pinpoint things. People will say, I've been depressed ever since I was like 18 years old. When did you get your wisdom teeth out? When I was 18 years old. Interesting. I've had eczema ever since I was 20. When did you get wisdom teeth out? When I was 20. I've had insomnia ever since I was 16. When did you get wisdom teeth out? When I was 16. Interesting. So we go back and we clean these out. So my goal is to never have to have anybody get their wisdom teeth out. But if you've had them out, go get a cone beam CT scan, make sure that jawbone actually healed. We'll clean these out 60 years later in people because they want to have their health back.
This is all new information to me, and I'm excited to hear it. This is the reason I do this show. Well, for my own
Exactly.
excitement, but but I mean, just think if we're saving somebody from decades of suffering from something like this.
Yep.
Wow.
Yep. One of my craziest stories that was just literally last week. I saw a woman, her cholesterol was 900. And for those listening, it should be below 200. Like 900 is crazy talk. So she'd been to every doctor, had tried everything, and they could just not budge this cholesterol. And I understand cholesterol as basically the body's warning system. It's the insulator saying something's wrong. So you need to figure out what's wrong. They tried everything. Finally, the doctor thankfully knew a little bit about dentistry and said, go see your dentist. Like, let's just go see. Go talk to this lady. She's talking about this stuff. Go see if there's something going on. We found 3 badly infected root canals. So she came back last week with her husband. She was bringing her husband in as a new patient. And she said, I've got to tell you my story. She said, my cholesterol was 900, as you remember. She said, I got my teeth out on May 3rd. And on May 4th, I got my blood tested again. And my cholesterol dropped 90 points. Just from those root canal teeth being removed. Just that. So it's just the body's inflammation out of control, warning signals saying, pay attention, something's going on. More often than not, it's something in your mouth. It's a failed root canal. It's infection where your wisdom tooth came out. It's you can't breathe, so you're squeezing and clenching your teeth because they took out teeth for braces, whatever it might be. It's in your mouth. So this is why everybody should go get a cone beam CT scan.
Now, it's just under the umbrella of like a holistic dentist, because when I see that, I think dentistry isn't holistic, but the way you're talking about it is.
It's 100% holistic. So when I first started down this pathway for my own reasons, to get myself well, I started calling myself a holistic dentist. And people responded like you, like, heck's this? Or they're like, okay, they're like the crazy people. They're doing like peace sign and incense and they're having beads in the door, like they're like the crazy ones. And I'll tell you, we are not that at all. I've started actually calling myself a health-based dentist because you say holistic and people think you're crazy. So I'm like, okay, fine, I'm not holistic, I'm health-based. I look at your mouth and say, how could this be affecting the rest of you? And people come to my office. We have a huge multi-specialty campus where we have all these things all together and many doctors, and they come and they say, this is the most technologically advanced dental office I've ever been to. I'm like, yeah, because I have to defend every word that comes out of my mouth. The other dentists, they just do what everybody else is doing. I have to just tell you and show you with research, with science, that this is why I'm doing what I'm doing. And there's something to stand by it. So yeah, we are at the top of the game, not at the bottom of the game.
I always think about what it's going to cost me because it's outrageous. Everything is.
Yep.
So I have Delta Dental in my health plan. So I go to a Delta dentist and, he bills the thing and then I pay the difference. Yeah. What if I wanted to go to a holistic dentist for whatever reason? That's a different thing. How does that let's just talk about the practicality for a lot of people who are, have limited finance or just don't want to spend, multi-thousands of dollars on this. And if you're sick, it's worth it. If you're sick, it's worth spending whatever it takes to feel good. That's my opinion on most of this stuff. But I'm just looking at, let's say I want to just sort of get a new take on what's going on in there, just to know. Yep. Knowledge is power. So
exactly right. So cone beam CT scan, sometimes insurance covers it, sometimes it doesn't. It's in the $350 range, somewhere in there. So
that's not that bad.
Exactly.
Okay.
It's not terrible. It's one of those, you kind of, it gets you the information you need to get started. And then I talk with people all the time about it. We don't actually take insurance in our practice for a couple of reasons. I remember the day that I was looking at a patient's chart and they needed something. They needed a specific procedure. And then I saw that they had a certain dental insurance. And in my mind, I thought, I'm actually not going to recommend that they get that care because let's say I charged $100. That's what it costs me to do the work. The dental insurance actually requires me to write off half of that. So I was going to make half of what it actually cost me to do the work. So in my mind, I said, I'm not going to recommend that. And I went, whoa, 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 whoa. I can't do that. That's my integrity right there. That's on the line. I will not do that ever again. And so I
Mhm.
said, I can't be on this plan because I cannot diagnose based on what the insurance company tells me to do. That is my integrity, and I will not do that. So what we do is we're what we call insurance friendly, where if the insurance will pay, we are happy to have that sent to you. We do all of that and work inside of insurance as much as we can. The other
Mhm.
thing that we do is I'll say things like, you know what? Here's a bunch of fillings you need. Go to this dentist. They do take your insurance, and the fillings are going to be comparable. But if you're going to get a root canal removed, come do that part here. Or, if you want to look at your airway, do that part here, do this part here. Go get your cleaning done there. So I'm very good at looking and saying, okay, here's the pieces that you're not going to get elsewhere, no matter what. The insurance is going to pay for them anyway. Come here to do that. The insurance would help with. This is, done well in this practice. So go there. So that's really a way that I feel like people can get what they need while fitting it in financial limitations if they have them.
Okay. So, I would love to get one of those scans. That would be that's of great interest to me.
Yep,
I just want to know what's going on there.
exactly right. There's so much information to be gained, so much to be gained by looking at the scan.
Now, the people that do those, they know how to read them and interpret them the way you are, or is that
That's a
is that
whole
another
other
issue?
thing too.
Yeah.
But so I actually have a directory. I have so many people asking me every single day, how do I find a dentist just like you? So
Yeah.
I actually now have a directory on my website. So my website is livingwellwithdrmichelle.com. Go on there and there's a directory. It's for you. It's for all of you who are looking for dentists, and they are dentists that I have vetted, that I know they do at least some of what I'm telling you about. Not everybody does everything, but they at least do some, and they have this mindset. So I've already vetted them for you. I've already identified them for you. I have a nice little map on there. You can search for somebody that's near you, and that's where I recommend people start. Go find somebody on that directory.
Say the website again.
livingwellwithdrmichelle.com.
Okay. Well, it's got a nice little poetic
Exactly. A little lilt.
little lilt, the L and the L, doing well, and Michelle.
Yep.
Good stuff. Okay, well, that's important. Now, anything else you want to talk about with this, because it's pretty fascinating stuff. I have to say, I haven't been this intrigued in a couple of days,
At least 2 days.
at least.
And honestly, that's the response I get so much. I was on a podcast just earlier today with a functional medicine doctor who focuses on thyroid health. And she just said, my mind is like, she's like, mic drop moments, like, moment after moment after moment on here. Why are people not knowing? And I said, honestly, medicine and dentistry in general are about 15 to 20 years behind in the education aspect. So if I were to go to dental school today, I'm going to be learning what I was learning 15 years ago. Okay. And that's just what it is. I mean, institutions just move
Yeah.
slowly. So what my whole mission is to get this information into the hands of people who can do something about it, which are you and all of your listeners. Because what you're going to do now is you're going to go back to your dentist and you're going to say, I'm not going to use that fluoride. I learned about it. Have you heard of hydroxyapatite? You people should really have hydroxyapatite in your office. So the change in medicine and dentistry and all of these things is going to come from all of you who are listening, that
Yeah.
are now learning enough to be educated, to really be advocates for your own health and say, no, I've learned about that. And it's not what I want for me. It doesn't feel right for me. So do you have an option for me? And I'm not confrontational. I don't go and I throw things in somebody's face. I just say, hey, can we meet
Yeah.
somewhere in the middle here? You know what I mean? I don't feel good about this. So is there something else that you have that will work for me? And have you learned about this? Have you heard about this? This is something I think that could be good for a lot of people in your practice. That's really what my mission is to teach all of you so that you'll go and ask more of the dental profession in general.
Yeah, I get the feeling sometimes they do know about stuff. They don't bring it up. I do get there's a piece of that.
Yeah.
And then there's also they just don't know.
That's the biggest one.
That's the biggest one.
That's the biggest
And I don't and there's sometimes an unwillingness to even explore it.
Yeah. Yeah.
Like,
It's
and you
comfortable.
wouldn't have done it if you hadn't had a problem. You never would have looked.
I probably wouldn't have because I wouldn't have had a reason to,
Yeah.
Yep. And it's comfortable, it's just like every career. You get kind of in your groove. It's comfortable, things are working. Why would I
Hmm.
change? And I've talked to numerous practitioners and they say that. They say, "Well, why would I do this? Like everything's working fine,
Yeah. Well,
What
I
problem
get
am I
that.
trying to solve?" And so that's again why I'm saying to all of you, go ask because the more of you that ask, that gives them a reason to change. Because right now, they can just keep going on doing exactly what they're doing. And you just keep coming and getting your teeth cleaned and your root
Yeah.
canals done and going on your merry way. But if more people start questioning it and saying, I think maybe there's something else that I'd like, then more dentists will have to
Well,
start changing.
and you mentioned something interesting. I mean, and it was a functional medicine doctor, but if it wasn't a functional medicine doctor, it was a thyroid specialist. They're not looking at other things except the thyroid with a lot of these
Yep.
things. It's like I don't know what they call that when it's that model of medicine where,
Specialization.
yeah, but it's something. It's like, oh, you got a heart problem. There's something wrong with the heart.
Yep.
You have you're diabetic, so it's this.
Yep.
And there's a lot of these lifestyle diseases that happen, and now we're seeing this dental thing being a part of it.
Yep.
This compartmentalization, that's what it is. It's just it's like, how are these things connected? It's like all of a sudden, you get depressed at 18 and you don't know why. Well, for me, I thought it was just teenage hormones,
Yep.
and the realization that the world is a fucked up place, and so now I'm going to get sad.
Exactly. But it could have been your wisdom teeth. I mean, who knew, right?
Well, I
And
mean,
so
who know? I'm not saying. I mean, when you said that, I went, "Oh,
exactly.
when did I start like really
Uh-huh.
feeling lousy about myself?" I mean, I don't
Exactly
feel
right.
that way now, but it did, but it is there. There is a sense a lot of the time of,
Yeah.
I don't like this.
Yeah, exactly. And
So
the part of the world, the part of the challenge that we live in today. So I've just written a new book. It's released in May 20th, called Living Well with Dr. Michelle also. But in the book, I talk about this and I say, there's so much discussion today about what kind of medicine is right. Is Western medicine right?
yeah.
Is
Hmm.
traditional medicine right? And I'm going to challenge the thinking on that and say, let's talk about a cut finger. If you have a cut finger, and you put a band-aid on it. Does the band-aid do the healing?
The body does it.
You got it. And what in the body does it? Your cells, right?
Yep.
Your cells
Hmm.
actually have to do the work. And the amazing thing is that you don't have to tell them what to do. Like they're going to go and repair that cut finger and knit those skin cells together so tightly that they don't separate again. And you don't even have to tell it how to do it. It's incredible. So it's the wrong question to say what kind of medicine is right because all medicine is just a band-aid. All it does is support our body in doing the work. All healing has to happen inside of us with our cells. So the right question is, what do my cells need to do their job? That's the right question. And
Hmm.
there's now that what that does is it really cuts through that overwhelm and that confusion. It's to, all right, what do my cells need? And again, there's so much overwhelm sometimes in deciding which cells need the help first. I've created an assessment that asks you your symptoms. You plug in your symptoms and it tells you which cells need your help first. And then it tells you what to do with for those cells. And really, it's all just about that. What do your cells need? So you take things down to, okay, I'm depressed. All right, you plug in the symptoms. It says, okay, these are the cells that need help first. Okay, great. What do I do to help those cells? This. Great. And you just start working toward the answer instead of drowning in the overwhelm of, was my depression because of my wisdom teeth? Or, let's just give your cells what they need today. And slowly they will tell you exactly where to go next, what to do next. Anyway, that's what the whole book's about, is about how to interpret what your cells are saying to give them what they need to keep you well. And it's just simply to give you a way through the noise today.
That is the beauty of the human body. That kind of power.
Yep.
It's completely magical when you think about it.
It's
It's
amazing.
and a band-aid might help you put the skin closer together. That might be
Sure.
helpful.
It aids, but it doesn't heal.
No. The interesting thing is when you hurt yourself, what's the first thing you do? You put your hand on it.
Mhm.
The body helping the body,
Mhm.
right? That's the first thing you do. You can't even help, but
Mhm. It's
not
like,
you have to do that. It
yeah,
just happens.
exactly right. Yep.
You have a headache, what do? You touch that part that hurts.
Yep. Yep.
Yeah.
Yep. Because you're signaling your cells. Time to go to work, boys.
Yeah.
Let's get going up here. Yep. Absolutely.
Wow. This is what a great talk. Man, have I enjoyed this.
Well, thank you so much for allowing me to share.
Yeah, so great. Let's do the website one more time because I think that's the clearinghouse for all this great information.
Yep.
I'm going to see if
Exactly.
I can say it. Living Well with Dr. Michelle.
Good job. You
Dot
did
com.
it.
And there's no dot after the doctor.
Nope.
Yep, it's
Yep.
just one
ER.
long,
ER.
beautiful
So,
sentence.
yeah, exactly.
Be-
Yep. And go on all the social channels there too. I have all these cool stories that I'm sharing. Every day that I'm in the clinic, I come off and I record a whole bunch of videos about all these stories and things. And so get on those social channels because it's some really, really
oh,
useful and
okay. Yeah,
interesting information.
how did I not mention that? But you did, so thank you.
Mhm. Yep.
Do we like the TikTok or the Instagram the most?
Doesn't
What?
matter. Go anywhere you
Okay,
want. Instagram has the most information, but
yeah.
we put it everywhere. We put it everywhere. I just
This
want
is the
people to know.
beauty of social media, not the stupid shit. This is the stuff that gets out there for people and they can actually learn something.
Yep.
And
Yep.
this is what I love about technology. This stuff.
Yep. Exactly right.
Bring it back to something doable and human and real.
Exactly right. Yep.
And if you want to throw in some, fashion tips, go ahead. I don't care.
That's right. It's got to be entertaining too.
Well, thank you, Michelle. What a wonderful talk. Have a blessed day, continued success, and thanks for all the great info.
Thank you.
Much appreciation for you folks listening to The Exploding Human. The website is theexplodinghuman.com. There's a YouTube channel where you can listen. That is The Exploding Human with Bob Nickman. Once again, I want to thank Dr. Michelle Jorgensen for being on the show. If you'd like to find out more, you can go to her website, which is www.livingwellwithdrmichelle.com. Have a great day. Thank you.